for joining us today. You can see that we will be talking with some amazing nurses that completed our Integrative Health and Lifestyle program. And the format will be that I will be asking them some predetermined questions. And when that part of the panel is done, then we'll go to the audience to see if you guys have any additional questions. But feel free while you're listening to, if you want to capture your questions or thoughts in the chat, you can go ahead and type them in. Morgan from admissions is here and she can answer anything that's about the program and dates and that sort of thing. But also at the end, if you want to unmute, we can do real voices and questions, which I know I always enjoy seeing who's with us. And what I always forget to do, I always forget to introduce myself. I'm Molly Burke. I'm Director of Online Education here at the Andrew Weil Center for Integrative Medicine. And I also am Program Director for the Integrative Health and Lifestyle program that we're going to be talking about today. So I'm going to go ahead and stop share, and we're going to spotlight our panelists so everyone can see. One day I'm going to be super fast about this. All right, where's Elise? I saw you there before. There you are. Gotcha. And spotlight. There we go. There's our crew. I just want to thank the panelists for spending their time with us to answer these questions. I'm going to go ahead and I will start with Omira. Will you tell us a little bit about yourself? Where are you joining us from, your professional background, and what you're currently doing?
Hi everyone, my name is Omira Hanif and I am joining in from Austin, Texas. I'm a registered nurse and international board certified lactation consultant. I have been in the nursing field for a little over 10 years now. Most of my time has been spent in maternal child health, public health, community health. I worked briefly in the hospital setting. Um, Currently, right now, I'm working PRN kind of as needed at a hospital as a nurse and lactation consultant. But I launched my business at the beginning of this year in January. It is called Lucky's Integrative Health, and I offer lactation services and possibly next year health coaching. I've completed the IHeLp program. I believe it last year or the year before. I feel like the years just kind of all jumbled together as
2024.
post-COVID.
Yeah.
Um, and so that's been, I feel like it's kind of given me just a wealth of knowledge and experience and a bit more confidence in, opening up my own business, something I never thought I'd wanted to do. Um, yeah, that's a little bit about me.
Thank you. Bill, will you tell us about yourself, where you're joining us, and professional background?
Yeah, hi everyone. I'm Bill Mertz. I am coming from Oakland, California currently, and that's where I'm from originally. I have been working in nursing since 2014, and it was sort of my second career. I restored old cars for a long time, actually. And I've been mostly in case management. I got a master's in case management and was doing inpatient discharge planning, case management, and now I'm at Kaiser Permanente, which is a managed care organization, and I work in what they call transitional care, which is sort of like post-discharge, like bridging the gap between the inpatient and the outpatient setting. I do case management for high-risk patients there. And I was when did I complete? 2022 is when I completed the IHeLp program. So just on the tail end of COVID, yeah.
Thanks, Bill. All right, Olivia, tell us about yourself.
Hi, everyone. I'm Olivia Teixeira. I'm from Santa Clara, California. I've been a nurse for 14 years. Most of my experience is critical care, so medical ICU, cardiac ICU. Then I transitioned to the interventional platform, so pre-post cath lab, and now I do all pre-op and all recovery. I did IHeLp. Elmira and I are in the same class. We finished in 2024, and it was lovely. I learned a lot. I'm so happy I did it. I recommend it to anybody who's interested in integrative medicine. I've also spent about 5 years. I did a per diem at the clinics, working with like concierge healthcare for some of the local tech companies. And I'm also doing a per diem right now at a county hospital, as well as a fellowship for the academic hospital I work for, which is about a 1 year long program. But yeah, happy to see some interested faces and some familiar faces.
Thanks, Liv. Elise, tell us about yourself. Where are you joining us from?
Hi guys. So I am joining you from Bradenton, Florida. The Gulf of Mexico is like 100 feet that way. So if you're wondering why I look like this, it's because I'm sitting under a tiki. But it's been an interesting day. And so my name's Elise again. I've been a nurse for 14 years, and my situation's kind of interesting right now because I've been, ever since COVID, trying to continue to find where I fit in the current healthcare system. And I currently work 3 jobs. I barely get by financially. I'm in Florida, so they don't pay nurses very much here, but I work at an endoscopy clinic, I work at a vitamin infusion clinic, and I work at an infectious disease clinic. I use most of my integrative, so I graduated just barely in July, and I loved the entire program. And the whole reason I took the program is because I wanted to get a taste for what this program offered, because I'm really interested in taking the fellowship. And so I'm starting my FNP in January. Once I complete that, and I will be applying for the fellowship. But yeah, it's just interesting to continue to work as a staff nurse, and just I'm still very highly excited and motivated to get back in and apply for that fellowship, even though I still got about 2 years to go. But you'll be seeing from me, so I hope you're still there, Molly.
Yeah, well, I've been here for 25 years. I'll probably be here for a couple more. Yeah, but you could hear these themes of like, well, nursing is just, there's so many different areas where nurses engage in health and patient care, but also so much risk for burnout. And I'm hearing these like explorations of where do I want to find myself. And that comes from folks when they start IHeLp, and like, right, you're continuing this path, looking to folks who start their own business, and folks who just try to weave it into the work they're doing, or bringing it forward. Yeah. So just for the folks in the audience, the NPs and RNs are eligible for IHeLp. NPs are also eligible for our fellowship. And we've had a few folks who do our IHeLp and then do the fellowship, and love it all. So that's great. So we're going to jump to the next question on the list, and I'm going to start with Bill. What are 1 or 2 elements from IHeLp that were most meaningful or impactful to you personally?
Yeah, I think it did. I mean, the whole program was really impactful personally. I think that maybe was a surprise. I mean, a little bit surprising how much it impacted me that way. So there were so many little takeaways, but just the deeper life and how important that is to me, and how that it all starts there and then flows out to everything else, your relationships, your work, your day-to-day stuff. And so from the program, I've made a lot of changes to my life, like some very small, some larger. I would say, a consistent meditation practice, lots of like little dietary changes, and things like that, which have really kind of been grounding and I guess nurturing to me. And I think overall, one thing I took away was just to prioritize taking care of myself in that way, as like a foundational practice to like like everything else. It's like, we always hear that analogy of like put the oxygen mask on yourself first, but it's kind of like a deeper, slower version of that. Like really like let your like nourish yourself first, like rest yourself first, like take care of yourself, and maybe having a better understanding of what taking care of myself really looks like. I would say.
I love hearing that. Like, and it's still with you. It's still impacting you that way. Liv, tell us 1 to 2 things personally impactful.
I agree with Bill 100%. The knowledge that you gather from this program, all the notes you have, all the material you have, it's valuable for the rest of your life. Whether you take it and you kind of sit with it, you start your own business, you think about doing that in the future. Like, I just feel like I have such a large amount of tools in my toolkit that I wouldn't have really gathered from any other program or any amount of reading on my own. And just like the guest speakers we have, it really does, all this really does change the way you live. Um, because you're just more cognizant of healthy living, and you see it in other people in your life. And I really loved a lot of the material on like herbs and essential oils and aromatherapy. And we see that now in Western medicine in the hospital. And it's so nice to have so much more of a background on it than people that come to, present it like reps or something. It's like, oh, old news, bro. I know like a lot of that stuff. And it's nice because you could use it yourself. You could use it with the patients. And you just have so much more knowledge than most people. And it's really nice to be somebody that can help other people with that. And yeah, I loved so much of the program, but if I could think of 2, it'd be my own lifestyle and then herbal medicine and aromatherapy really were lovely, as well as sleeping. But yeah, like sleeping enough to dream and just knowing kind of landmarks of good quality sleep.
Awesome. Thank you. Elise, 1 or 2 things that were meaningful or impactful to you personally?
Yeah. So I would have to say the biggest part of this that were impactful for me was the self-care aspect. That was actually a big reason I chose to take this program, is because I had a lot of detrimental stuff that happened to me last year, and I just really wanted to get back to self-care. And I love that it touched upon everything: sleep, diet, nutrition, relationships. That was a huge part for me, spirituality, ceremony, just so many things. And then I think a really big thing that I got from it was a sense of community, because I feel like most of the times, and I work 3 jobs, you work with fellow nurses and fellow doctors, and I think their mindset is we're still kind of stuck in this system that's just not really working. But to meet all of the people through IHeLp, that just kind of made me feel like I belonged, because my mindset about the way healthcare needs to change was completely validated. And I mean, our system's great, don't get me wrong, but it just made me feel more included and part of a community where people understood how important those lifestyle factors are, like sleep and spirituality and having healthy relationships. And so I guess those are the two biggest things I got from it, was the importance of self-care. And that's something that I try to share and point out to all of my patients every single day, is that it's okay to take 5 minutes for yourself every day. And then just that level of community that I got through meeting all of the nurses and the nurse practitioners and all of the providers that we met at the program it was just so fulfilling and heartwarming. I'm getting goosebumps just thinking about it, because that retreat that we had in May was just unbelievable. I think I cried every day because I was so happy and so in love.
Love it. Thank you so much, Elise. Well, Myra, what about you? 1 or 2 things personally impactful.
Ditto to what everybody said, and to add to it, one of the things that really impacted me personally was learning about breath work. I had known about it here and there when I would take yoga classes, but to learn like the science behind it, and then for us to practice it. And then when we had come in for that 4-day retreat, and we had the physical therapist and yoga instructor walk us through it from just the basics of breath work to more in-depth breath work, that has sat with me till this day. And it's something that I do with a lot of my clients. It's so simple. And the way in which the program taught it to us, I feel like right now with the wellness industry, sometimes we've kind of overcomplicated things. And so the way that the program taught things, it was just such a great approach in that it was I felt like it gave me tools specifically with breath work that's free, that's equitable, that I can teach anyone to do it, and then they can take it and teach it to their families. So that's something that I practice a lot till this day. The second thing, and I love that Elise brought this up, is just that validation of there are other healthcare providers who also are looking at the system and saying we can do this more holistically. And here's the studies and the science behind it. Because I think too often sometimes we can become so medicalized, and there is beauty and science behind that too. And part of that integrative health is that we're integrating the two together. And so the way in which the program was laid out, that made me feel like just even with my own life, like I can take certain medications, but I can also add in the supplements and the walking and the nutrition and looking into my relationships. And there was one sheet that we referred a lot to, and that was the 7 core areas of health. And I love how like they really broke that down so we could hone in on each area. I would say it's hard to pick two, but those would be some of the ones.
Well, that's great. Thank you so much. Yeah, I mean, you guys have touched on the self-care, which is, a huge part of the IHeLp design. It's woven from the very beginning through to the end. And because we know our healthcare professionals need to be taking care of themselves, as Bill said, put that mask on yourself first. We really want to make sure we are not bringing students in and giving them more work and adding to the burnout, but actually building their resilience and prioritizing time in the actual work schedule for self-care. The retreat, I heard that. People love being able to come together, share physical space, and get their hands on activities about all these things that they were learning about online. Some of the curriculum that was mentioned, herbal medicine, essential oils, spirituality, mind, body, breath work, really the 7 core areas, which also tie into your self-care work that you do. All just critical elements of the program, and it's nice to hear how they resonated with you all. I want to shift over to the impact on your professional lives. So I'm going to go ahead and start out with Olivia. Will you tell us 1 or 2 things that you've incorporated from what you've learned in IHeLp in your professional life?
Yes. Self-care being, of course, probably the biggest thing. The program requires you to be organized and very structured. It's well organized itself, to be remote and makes so much sense to have a class. You're kind of sectioned off into different groups, and you kind of become close with those people. You're sharing vulnerable moments. They became people I was studying with before the final test, and you connect a lot at the retreat. And then you talk about your future goals. And that's what's nice. Even as an alumni, I've caught up with Amira, and she told me about her business idea. And yeah, so self-care, and then knowing like adjunctive therapies to use, like Amira was mentioning, okay, patient might need this medication, but what else can they do to complement that Eastern medicine might offer that, people aren't really talking about. And having that access to that knowledge is huge. So yeah, self-care, and moving forward, I one day plan on doing a business myself, and I have all of this information that I can bring, as well as knowing the fellowship is available. I know a few people from my class that went and did the fellowship, and I just love seeing their Facebook posts of things they're doing, projects, if they already had a business, things they're adding to their business, since they can prescribe. It's just so lovely to see the growth professionally you can have, and the connections you can have networking moving forward. And people are from out of state. I think we even had somebody in our class from Norway or something, Iceland, somewhere out of the country. Like, this is such a renowned program throughout the country that I am just so grateful to always have that education. Yeah.
Great, thank you. Elise, what do you think? One or two that you've been able to incorporate? I know you're juggling 3 jobs, but professionally, how do you maybe bring some of that in?
I do a lot of teaching at my jobs, and I'd have to say my endoscopy job has been a big outlet for the information that I've learned through IHeLp, because I think I did my grad paper on the connection of the gut-brain connection. And I did it because I worked at the endoscopy clinic, and I kind of wanted to focus on that because I've seen for many years how mental health can contribute to GI discrepancy. And I've seen so many times with my doctors, they just they don't really do much for the patients besides give them medication. But when I get them in my 15-20 minutes of time, I get to teach them. And the biggest thing I think I always ask my patients, and this applies to my vitamin infusion clinic job as well, is how much are you sleeping? And I can't tell you how often people tell me that they don't sleep at all. And so it's been really rewarding to be able to talk to them about their sleeping, and using that motivational interviewing to figure out, like, kind of giving them a reason to accept that it's okay to sleep, and teaching them how to make an environment that is conducive to sleep, and just allowing themselves to get there, and talking about dream health. And with the GI patients, I talk a lot about nutrition, probiotics, prebiotics, listening to their body, and then of course everything else: physical activity, relationships. And so I think I appreciate, and when I get the chance, I usually get a few moments to just teach people and talk to them and connect with them, and they come back with good rapport. They could come back with feedback saying, hey, I actually tried this and it really helped. And a lot of it is like recommending herbal therapies. And so I've gotten to use it a lot. I actually didn't think I did because of the systems that I work with, the clinics that I work in, but it's been very rewarding, and it's very motivating to push me to continue to keep progressing in this line of work and just developing my knowledge with integrative medicine, because there is a place for it, and there are so many people who are receptive to it. And that is, I think, the most rewarding thing. There is sick care
but there's also wellness care and people want it right now. So thank you.
Yeah, thank you. Well, Myra, what about you? I know you're starting this business. How are you incorporating what you've learned in professional?
Mhm. Yeah. So in one of the services that I offer, it's lactation work, and one of the biggest things that we really recommend is body work, because when you're feeding, it's all connected to the whole body. And so I think we had a whole unit on body work. And so having a better understanding of that, and then going to conferences or taking continuing education classes, it just comes so much more easier to me. I feel like I can ask questions that I normally wouldn't know even where to begin with. Um, so that's one specific aspect with lactation. And then in terms of just working with clients, just that holistic side of things in looking at the mind, the body, and the spirit or soul. Um, and again, that 7 core areas of health, because too often we don't really ask, like, hey, what is your community like? Or how is your sleep? Um, and so just to ask that question as a nurse for people who may have never had that question be asked to them gets them on that journey of maybe I should look into that a little bit. Um, I think also when I speak with, I'm a nurse, so I have to stay within my scope, of course, but when I speak with other providers, physicians, PAs, MPs, being able to refer back to the modules, and we have access that if we subscribe to every year. And so if there are certain things that I'm like, I'm not feeling too confident about this, and being able to just pull out like research and um, ideas from there and then hand it over to pediatricians who may be asking questions as to like, well, why would physical therapy be needed for this specific issue that we're having with a baby who may not be transferring enough milk, for example? Or, why is sleep so incredibly important when we have to now transition into, bit of formula feeding and combo feeding, because we're looking at the client as, really holistically, the whole person. And I think also we studied a little bit with motivational interviewing, and I know it's not true health coaching, but that was really helpful to do that unit, and then to kind of at the retreat we like played it out, because I think as nurses we do little bits and pieces of it. We naturally look at a person in a very holistic way. We just may not have the time, or the system that we are in may not give us that permission, or they may not even know themselves. Um, and so in some ways you almost become like an educator without even knowing it, to just the other professionals around you as well.
Yeah, great. Phil, as that bridge from inpatient to outpatient, are you able to incorporate some things from IHeLp?
Yeah, definitely. It's kind of like an astounding amount, I think sometimes. I've really like reframed how I do my work, I think, like so I follow patients for about 30 days right now, so we call that short-term case management, but a lot of touches. And, when I do my assessments now, I find that I've integrated a lot of the areas that we covered in the IHeLp program, like just right into the assessment. And um, I love when I get to connect with a patient who either maybe themselves is already bringing something up that's like an integrative approach or something, and that's like the in, or sometimes it's me suggesting it, and them for the first time considering like, oh yeah, that is interesting. And I think what the program, Myra said this well, is like this gives us the science background that really like solidifies it for a lot of people that might otherwise be skeptical. And then that also is similar with providers, I think. So like pushing, I mean, but I guess two ways. One is sort of asking. I work with a lot of primary care, but also specialists, mostly just like helping with symptom management or helping to get appointments set up. But sometimes, you might have someone with like chronic pain, and you might want to see if acupuncture could be helpful, and the patient themselves a little hesitant to ask, or things like that. And then also, I love when you connect with a provider who's kind of on board already, and that for me is great at Kaiser, because we're always kind of working with the same provider. So once like, oh, these are kind of allies, I can go back to these people when I have someone that is wanting that type of treatment, or so it's been really great, and impactful at work for sure.
That's great to hear. All right. UK, I'm going to stick with you for this last question, Bill. And that's thinking about the nursing field. What do you see are the key benefits of someone in the nursing field participating, enrolling in IHeLp?
Yeah, I think there's the benefit to self, just like taking care of yourself so you don't burn out. Like I don't think we could probably overstate it, state it enough. Um, it's so important, and it really helps you to find out what you need to do to take care of yourself, to kind of keep going, and also like what direction you want to go in. From a patient care perspective, I see, I guess I see all the knowledge, being able to kind of disseminate it to where it needs to go. I mean, the two things that came up for me right away were like, a lot of people I see have some form of anxiety they're dealing with, and whether that's like a symptom of something else or a cause. And there's so many obviously different ways to go about helping with that. And so being able to offer things besides medication to those patients is such a relief to them, just to like it gives them hope. It gives them stuff to try. Um, chronic pain's another one. There's so many ways, and we learn, to treat that. But we learned a lot of little things, and like I feel like as my role as a nurse case manager, like pretty much every day I'm using it in some form. I mean, I can't tell you. I tell people how to do 4-7-8 breathing like all the time. I'm like, that's on my like repeat playlist, and it's great. And so I really like those nuggets, and it keeps you curious to learn more too, or go back and kind of, you're like, "Oh, I kind of remember learning about that. Let me go refresh a little bit, or learn something new in the same field." So yeah, in my role, I find it really has been super useful. I can't remember who said it, but we're all kind of educators, and I think in my role as a case manager, I do a lot of education, and so it's so nice to be able to give some integrative health tools to our patients, so they can help take care of themselves, really.
That's great. Thanks. Well, Myra, what do you think?
Molly, I'm so sorry. May you restate that
Oh, of
question?
course. Yeah, that was the first time I'm going to go short. So we're talking about like everyone who's in the nursing field. Like, what are the benefits for someone in the nursing field
Mm,
to apply for IHeLp?
mhm. I think it just strengthens your skill and allows you to learn things that we just did not learn about in nursing school. Or if we did, it was probably like a 5-minute slide. Um, I think that it can help you to get a better idea of what you may want to do in in your goals as far as your career, whether you do want to pursue like advanced practice nursing, um, or you want to just become more of an expert, whether it's with breath work, whether it's with herbs. Um, I think that it can give you a bit more confidence in what you're doing. So for me, I grew up in a culture where a lot of the things that we learned and I saw my grandparents, my mom, my dad, my aunts, my uncles do it. But the beauty of the IHeLp program is that it really helped to shed light on all different types of practices. And so you get, we're in a time right now where there's so much diversity, and so to have a better understanding of what Ayurvedic medicine is and Chinese medicine is, and how the natives really practiced back in the day, and it can help you to better understand the population better, and to kind of take little bits and parts of all of those things, especially in the US, because it is truly like a melting pot. And so we may not always feel like what we grew up with is fully exactly what we want, but I like a little bit of everything. And so to better educate people on that, I don't know how comfortable I would feel. I kind of want to study a little bit of everything. And I think that IHeLp did a nice job of really focusing on all the different modalities. Um, yeah, I think that would be, and then personally too, I mean, as nurses, burnout is like, it just feels like it's not a matter of sadly if, but like when. And it, there was something in our 4-day retreat, or in our graduation, where Dr. Andrew Weil said that you have to really live what you're learning, because then you can uh, better practice it, because people will be looking up at you to do it. And so I think a lot of the self-care tools and the practices that we were encouraged to do ourselves really helped, because once I started to see that the improvements within myself, I felt more confident being able to teach others outside of knowing the science of it too.
Great, thank you so much. Elise, well, how does this joining IHeLp benefit someone who's in nursing?
Well, I think, like, for me personally, I'm only halfway through my career, and I know that I was like born to be a nurse. I was born to be a healer, and where I started to get really burnt out, I felt like I either needed to change career paths altogether or find something different. And this was kind of my way forward. It was my way of not giving up and knowing that there are other paths that I can take, and it doesn't have to be within the current structure that we've all been practicing in for so long. And I think Bill and Omira hit two very important parts, is that the self-care aspect as well for nurses. Just like I said before, is I took this program mainly because the curriculum focused on self-care and I needed it at the time. And I really think that if we can take care of ourselves, we can take better care of our people. And then also, just with the variety of the program that it offers, it is so vast, like Omira mentioned, but it kind of gives you options. You don't have to teach all of it. You can learn about all of it, but then if you want to pick certain aspects of it and really focus and hone in on that, then that's what's beautiful. And that's what's always been beautiful about nursing in general, is that we always have variety. But this just kind of extends it into a whole nother realm. And I know I've said it before, is that like there's sick care versus wellness care. And I mean, we can still help those people who are incredibly sick take holistic approaches and find ease through whatever they're going through. But then we can also start teaching people how to take better care of themselves with the basics, and build a foundation so that they can have longevity. And so I think it's a great program. I'm so thrilled that I got to be a part of it. um, actually did not want to go to the retreat because I have severe anxiety and traveling was really hard for me at the time. But I am so grateful that I was able to go, because it was truly life changing. Like, I've been in a rut since 2020 with my career and with everything. And it like was a rebirth, and it was worth every penny. It was worth every minute of hard work. And I made so many good friends through the program. And it was great. I can't speak I speak so highly of the program, and I always will. And I have my Andrew Weil bag right here. I use it every day. I'm surprised it doesn't have holes because I've used it since May, but I promote everywhere I go. So
Well, thank you, Lisa. I really appreciate hearing all that. And Liv, what are your thoughts on beneficial to those in nursing?
echoing pretty much everything everyone said, especially Elise. Like, you do this program for your patients as well, but you do it for yourself, and that's gonna like you're gonna mirror that onto your patients automatically because you're just gonna be restored. It reignites, helps you like fall back in love with your career, with your home environment. There was a girl in my class that had throughout the program, because there's a section we talk about environment, she like renovated her whole room just, by putting different plants in there that are better to inhale and putting like a little Buddha lamp and make your home your sanctuary. So it really does touch on every aspect of your life. So you're doing it for your future health, your future career, and those around you. It's just contagious when you learn this, when you go through this program. Um, and honestly, it's like job security. I think of AI and how it's kind of making its way into healthcare in certain ways. And I feel like this is just something robots can't emulate. Like this is special stuff. Even in the hotel industry, the hotels that are doing okay right now in this economy are the wellness hotels. So having that leg up is important for career growth, job security. And like I said, it's for yourself. And patients really appreciate when you go that extra mile to offer this information and when you have that, because they know you didn't just stop at nursing school. You wanted to know more that really digs deeper at what a human is and what a human needs. So it's just, there's nothing like it.
Thank you so much. And thank you so much to everyone coming to hear our panelists for spending time. We have 15 minutes. I know Elmira has to leave early for a class, but if there are any questions, now's the time. Who has a question? You can raise your hand or put it in the chat, or if you because if you don't know how to put the little Zoom hand up, we can work with just unmute and give us your question.
Hi, friends. I don't know how to do the Zoom hand, but I do have a question. So my name is Ray. I'm a registered nurse. I am a first semester grad student, F&P student at UNC Chapel Hill. So I was just wondering, I obviously am interested in doing this program because I would really like to do it alongside my first semester of primary care to just kind of fuse the learning. My master's paper is also going to be on integrative health. So I just thought this would really complement my starting of learning with that. But how well do you think I could balance something like this along with being a grad student at a traditional grad school?
That's probably a hard question to answer.
Yeah, I don't know. I'm just like, I'm thinking of like how much I'm the type of person, I'll just pile all the workload on, but I want to make sure that like I get the most out of this. I don't know how much the time commitment really is. I know that I'm able to put some time towards it, but
Yeah, well, let me give you at least the numbers, right? And we have numbers and everyone learns at different rates and engages in different ways. But in general, we always say like, and it's different for these folks. They're going to be like, what? I thought it was 10 hours a week. But with the new design starting in 2026, we've made it from a 6-month to an 8-month program. And that was to not throw in more content at folks, but to let people have more time with the content and not as much workload every week, because that's another burden. So it's actually 6 to 8 hours a week now, expected work time. And I will just reemphasize that the self-care is part of that 6 to 8 hours. We don't just like find time to do the self-care. We're like, we calculate you're going to spend, this amount of time assessing your own health in the area of sleep after you've finished the sleep course. And you're going to come up with some self-care practices or behavior changes that you want to try to implement over the next 10 to 14 days. And then you're going to share it with your self-care team. So everyone, someone alluded to, everyone is broken into self-care teams that are faculty mentored. And that's where you share your experiences in working in these self-care areas. That's all included in that 6 to 8 hours of work per week. But I am, but you probably know better, like what your semester load is going to be and what would it be like to have that and have other expectations that come along with that program. Yeah. But I don't, panelists, anybody have any advice in that area?
I was just
Oh,
gonna say, oh, sorry, go ahead. Who was
no,
that?
go ahead, Bill.
Oh yeah, I know. I'm kind of like split. Part of me wants to say, yeah, it would fit. I think it would fit really well, and I think, it kind of would force some self-care on you, which might be good in a program like that. I think on the other side of that coin, part of me is like, you don't want to rush the process of doing the self-care and stuff. So, I don't really have a good answer, but those are kind of my two thoughts.
I want to add to that. I actually agree with Bill that like it is so much information and it is a lot of reading, but it is worth it. And it's worth it to do the reading when you are truly invested. And I will admit that like the first half of the program before the retreat, I kind of was stuck in this loop of like, I just got to read as fast as I can and get it done. And I don't think I got as much out of it as I should have because I didn't really take the time that I needed. I think it's awesome that they're expanding it from 6 months to 8 months. I mean, me even working 2 jobs, I was still able to do the program, but I guess it depends if you're going to school full time versus part time. If you're doing a full time graduate program, and you want to get the most out of this, you just have to really decide whether how much of a workload you want to take on. But it really is an amazing program, still worth taking, whether you decide to do it in conjunction with the program you're currently in, or if you decide to take it afterwards. But that's just a personal decision you have to make. But it is, I mean, it's a lot of information and you really don't want to rush through it. You want to be a part of it. You want to experience the self care because it is so rewarding. And yeah, that's all I got.
That's great. Thank you. I want to, I see Marianne's question about, I know that content is presented remotely, but is it synchronous or asynchronous, which is a good question. It's a mix. The majority is asynchronous, but we have a very week by week paced syllabus. So that expectation of you're gonna all be working on this module, on this course this week and doing this self-care or joining a healing talk, which is a synchronous 1 hour event where the faculty and experts come in and share more and answer questions with students. So majority asynchronous, but paced. So you might be a night owl and you're doing all your online asynchronous work at night, or you're covering it on your weekends, but not your self-care because that's all through the week. But there are moments, and Morgan will pop in a link to our program overview schedule, because right now we know what dates are those Zoom virtual healing talks that are an hour long. There's a 3-hour virtual motivational interviewing workshop, which used to be in person at the retreat. And then the retreat, which is at the end of the program now and includes a graduation ceremony. That is September 15th through the 18th. So those things, the only things that aren't noted date-wise are your self-care team meetups. And at the beginning of the program, you'll coordinate that with your faculty mentor and other team members to find like the best dates and times for you all to meet throughout the program. I think I got that right. Does anyone on the panel want to comment about the balancing of the asynchronous versus like live elements? Bill, I don't think we even had healing talks in 2022. I think that was a 2023 introduction.
I think I think now that it's down to 6 to 8 hours, I think it is more manageable. I know there were several people in my class that had like a few kids and a family and worked, and they were able to manage it. But I think it's nice to do sooner than later. And I think with the adjustment of hours, if you're organized about it, you can, you trade it in for Netflix, or you trade it in for one thing or the other. And I found some of the work that is homework actually meditative. So depending on the topic, it can actually be helpful, in my opinion.
Yeah, that's fair, right? It's about self-care. So then you get this tool, you get the 4-7-8 breath, or no, actually the activity is do meditation 5 minutes a day. It is uh, hopefully bolstering of your health and well-being for sure. I saw another question. So we got the retreat dates out there. That's September 15th to the 18th. And someone asked about class size, and yeah, around 40 is where our cohort lands. See, Virginia is asking, is it possible to develop integrated curriculum for BSN MEPN nurses to begin foundational development and concepts so it doesn't feel like we stumble into this post-grad, post-burnout, creating this idea of self-care sooner and being able to teach it to clients? Well, I love that idea. I actually was working with our College of Nursing for a while on different ideas and strategies, but I do like the idea of it being part of the MEPN program. But those things, university things take so long, and then leadership shifts, and then all of a sudden you're back to square one. But I would, I love the idea, and we have folks who are teachers, who are faculty, who are instructors that come through IHeLp, and I'm always excited about that, because I know no matter what, even if they don't have the most supportive dean, they're finding ways of bringing this in with their students from self-care on. And actually we have a new physical therapy program over at the U of A here. And we had a faculty member who graduated from this class with Elise, and, started incorporating that in with their first class of physical therapy students. So, yes, it needs to be everywhere, right? We all need to be learning the basics of what we can do to take care of ourselves. And like what Bill started from the very beginning, the core of what drives all those self-care assignments is you really looking at what's important to you. Why do you want your health for? And what's most meaningful in your life that you're going to be motivated to make those hard changes, because they're not even small healthcare behavior changes around your health, they can be a struggle. And that's one of the goals of having all our students do those self-care practices, is to build that empathy. Because maybe some folks come in and they're like, oh, I know, I make nutrition changes all the time, that's no big deal. And then they hit the resilience self-care activity and they're like, oh, why is this so hard? So we'd really learn about ourselves. So is there a new Chapel Hill has a professor who is implementing integrative medicine in our nursing schools. Excellent. Slow to go through right now, but she's been one of my mentors, and that's fabulous. I mean, the Andrew Weil Center was a founding member of the academic consortium in integrative medicine. And, to see the number of academic institutions out there that are embracing integrative medicine and health, it's heartening. Like I said, the center's been around longer than I have, but I've been around 25 years here, and just seeing the growth is heartwarming. And for IHeLp, I know we're talking with nurses and we're talking about the nursing field, but IHeLp is an interprofessional program, and everyone learns together and benefits from their different perspectives, because we're all touching the patient and the community in different ways. And if we can all do it from this holistic perspective, with our buckets full, right? Because we're taking care of ourselves. Maybe we can make a little bit of healing happen in that broken system that Elise was talking about. We hope to make a difference. All right, well, we're 3 minutes out. I don't see any more questions in the chat, but I just want to say it was great speaking with you all. Thanks for joining. If you are interested in applying, our program starts in January, but early enrollment ends October 27th. So if you would like to save money, you're attending, you get a free application code that Morgan will share with you. So get your applications in sooner rather than later. And then also you'll be eligible to apply for the scholarships that are due in mid-November, early November. Morgan knows the dates, right?
November 10th.
November 10th. Thank you. She'll include it in the email. But yeah, it's so lovely to speak with you all. Thank you for coming and sharing your story and spending your free time on Zoom with us. I really loved hearing about it. Have a wonderful evening.
Thank you.
Thank you so much, Molly.
Thanks,
Appreciate
Molly.
it.
Bye,
Thank
Molly. Bye,
you.
Thank you,
Morgan.
Molly.
Awesome.
Lovely to meet you all. Have a good day. Good night.
Good luck with your decision making. Follow your intuition.
Yeah.